Climate factors influencing chikungunya are true answer temperature, humidity, altitude, precipitation. False answer wind. A cohort may be open, closed, fixed. False answer antagonist, homologous. Database management model may be true answer hierarchical, relational. False answer medium, diagonal, historical. Level of disaster are featured by true answer level 1 wants support from community level, level 2 wants support from national level, level 4 wants support from international level, level 4 wants support from international level. False answer level 3 wants support from regional level, level 5 wants support from provincial level. Data collection instruments include true answer structured questionnaire, checklist, microscope, medical records. False answer K2 guideline. Philosophy of SDG concerns true answer universal healthcare, human rights, transformation, universality. False answer equity. A conceptual framework denotes true answer causal association, confounding effect, intervening effect. False answer prediction of association, direction of association. Estimates of retrospective study include true answer odds ratio, risk difference, cross product ratio. False answer incidence rate, risk ratio. ICD-10 codes for true answer signs and symptoms, complaints, social circumstances. False answer disability, deformity. Community diagnosis techniques are true answer community based meta analysis, community surveillance, community action research, community registration. False answer community counseling. Prion diseases are caused by true answer infectious proteins. False answer microorganisms, abnormally folded protein, neurotoxins, endocrine disruptors. Primary healthcare related declarations are true answer Astana Declaration. False answer Madrid Declaration, Geneva Declaration, Riga Declaration, Bandung Declaration. Barefoot doctor was a concept of true answer Chinese medicine. False answer 2700 BC, Greek medicine, Indian medicine 2100 BC. Manifest variables includes true answer IQ, intelligence, knowledge. False answer efficiency, skill. Features of complementary goods are true answer negative cross elasticity of demand. Demand for a good decreases if price of another good increases. Demand for good increases if price of another good decreases. False answer negative cross elasticity of supply. Demand for a good increases if price of another good increases. Qualitative data collection methods are true answer focus group discussion, in-depth interview, Delphi technique. False answer record review, physical measurement. Revitalization of primary healthcare denotes true answer universal coverage. False answer collaborative efforts, sheer conference of primary healthcare, leadership reform, public policy reform. Bias is a true answer systemic error. False answer chance error, sampling error, random error, methodical error. A case report includes true answer abstract, discussion, acknowledgement. False answer background, abbreviation. Demography is focused on true answer composition of population, distribution of population, change in false answer change in population, migration of population, mobility of population. Arthropods act as disease agent are true answer housefly, sandfly, each mite, housefly, sandfly, each mite, louse, mosquito. Basic activities of management include true answer organizing, controlling, communicating, false answer executing, evaluating. Long acting reversible contraceptive methods are true answer subdermal implant, intrauterine contraceptive devices, false answer hormonal oral pills, non scalpel vasectomy, barrier methods. Components of behavioral science are true answer social psychology, sociology, anthropology, false answer criminology, political science. Factors responsible for breast milk flow include true answer health condition of mother, feelings of mother, false answer fluid intake, family support, age of the mother. Opportunistic infections in HIV/AIDS are true answer tuberculosis, toxoplasmosis, cryptococcosis, false answer actinomycosis, leptospirosis. At-risk infants are identified by true answer working parent, artificial feeding, false answer congenital defect, birth order 2 or more, HIV infected parents. Characteristics of ideal complementary foods are true answer balanced, not frequent, tasty, energy dense, false answer costly. Vaccines contraindicated in pregnancy are true answer COVID-19 vaccine, varicella vaccine, MMR vaccine, false answer tetanus toxoid, hepatitis B vaccine. Population policy may be true answer implicit, explicit, false answer extrinsic, intrinsic, laissez-faire. Disease under surveillance in Bangladesh are true answer poliomyelitis, Nipah virus infection, false answer chikungunya, dengue fever, COVID-19. Insulin resistance syndrome. True answer is exaggerated by obesity, increased sodium retention may result from a genetic defect. False answer contributes to low level of TG, produces insulin sensitivity. Chronic carrier is caused by true answer hepatitis B virus, Salmonella typhi, false answer Corynebacterium diphtheriae, Plasmodium vivax, poliovirus. Case fatality rate means true answer killing power of a disease. Typical rate of chronic infection, false answer rate of deaths to cases, rate in a specified time interval, consequences of acute infection. Variables influence the causal pathway are true answer intervening variable, confounding variable, moderating variable. False answer multi-component variable, biphasic variable. Variables influence the causal pathway are true answer intervening variable, confounding variable, moderating variable. False answer multi-component variable, biphasic variable. Risk of infection following sharp injury comprises true answer HIV 1 is to 300, HIV 1 in 300. false answer hepatitis B 5 জনে একজন, hepatitis B 15 জনে একজন, hepatitis C 50 জনে একজন, hepatitis C 5 জনে একজন। এটা হচ্ছে হেপাটাইটিস বি হচ্ছে 3 জনে একজন, হেপাটাইটিস সি 30 জনে একজন, এইচআইভি 300 জনে একজন। Biosecurity in laboratory refer to true answer measures to prevent theft of laboratory data designed to prevent intentional release of pathogens. False answer true answer measures to prevent theft of laboratory data designed to prevent intentional release of pathogens, identify the vulnerability of misuse of toxins. False answer only institutional security, scientific and laboratory personnel only. Attributes related to medical waste are true answer: reduce and reuse are effective. Reduce and reuse are effective. Segregation is done after collection. False answer: 80% to 90% are infectious. Most of the waste are hazardous. Yellow bins are used for liquid waste. Significance of antibiotic susceptibility testing AST includes: to answer: provide appropriate treatment guidelines, monitor resistance development. AST must be done before treating ICU patient. False answer: identify any new species of microbes, compare trends in healthcare facilities. Vitamins involved in RBC maturation are: to answer: folic acid, vitamin B12. False answer: vitamin K, vitamin B1, vitamin E. Components of total energy expenditure are: to answer: thermic effect of food, physical activity. False answer: resting membrane rate, body mass index, mid upper arm circumference. Consequences of lactose intolerance are: to answer: abdominal discomfort, diarrhea. False answer: malabsorption of nutrient, fever, rash. Elements of human personality are: to answer: physical traits, intelligence, behavior. Physical traits, intelligence, behavior. False answer: motivation, religion, and caste. Physiological motives include: to answer: eating, sleeping, seeking shelter. False answer: recreation, dominance. Statistical test used to compare two proportions are: to answer: t-test, z-test. False answer: chi-square test, ANOVA sign test. Comparative research study design includes: to answer: cross-sectional study. False answer: longitudinal study, cohort study, ecological study, field trial. Human resources are maintained by: to answer: providing compensation, paying wage, giving benefit, issuing appointment letter. False answer: fulfillment of need of employees. Material management is important in case of delayed procurement, perfect anticipation of demand, pilferage and wastage, poor maintenance. False answer: low costing. Non-parametric tests include: to answer: ANOVA, Wilcoxon signed rank test, Spearman rank correlation. False answer: t-test, z-test. Objectives of quality health education should be: true answer: relevant. Objectives of quality health education should be: true answer: relevant, equivalent. False answer: feasible, measurable, non-specific. 95% CI of mean helps to determine 95% CI of mean helps to determine the range where the sample mean has 95% probability, the range where the sample mean does not have 5% probability. False answer: extract value of population mean, the range where the population mean has 95% probability, the range where the population mean does not have 5% probability. Coefficient of variation is needed to: true answer: compare relative variability. False answer: compare the variation of the same character in different series. Compare the variation of the different character in same series expressed by the respective units. Express mean as a percentage of SD. Compare relative variability. False answer: compare the variation of the same character in different series. Compare the variation of the different character in same series expressed by the respective units. Express mean as a percentage of SD. Quotient coefficient of variation is needed too. Sampling error is caused by erroneous. True answer. All answers are false. Observation, randomization, data processing, sampling, data analysis. Vital statistics include birth, marriage, death. False answer. Migration, social mobility. Nutrition cycle includes. True answer. Bad nutritional status, proper intrafamilial food distribution. Bad nutritional status, proper intrafamilial food distribution. False answer. Food production is increased, less food consumption by family, work capacity is increased. Eating disorders are. True answer. Bulimia nervosa, anorexia nervosa, binge eating disorder. False answer. Fasting. Hyperemesis gravidarum. Hyperemesis gravidarum. Hyperemesis gravidarum. Nutrients required for brain development are. True answer. Iodine, zinc. False answer. Folic acid, vitamin D, fibers. Nutrients required for brain development are. True answer. Iodine, zinc. False answer. Folic acid, vitamin D, fibers. Effective measures for safety program are. True answer. Education enhancement. False answer. Engineering enforcement establishment. Occupational hazard is. True answer. A source of danger of workplace, a life-threatening event for workers, a chance of harm to the workers. False answer. An inherent toxicity of chemicals, the extent of exposure. Garbage disposal methods are. True answer. Burning, incineration. False answer. Landfilling, sterilization, boiling. Randomized control trial is featured by. True answer. Systemic randomization, triple blinding, controlling confound. Systemic randomization, triple blinding, controlling confound. False answer. Cluster randomization, selective manipulation. Intellectual disability may be caused by. True answer. Down syndrome, phenylketonuria, Fragile X syndrome. False answer. Tay-Sachs disease, Alzheimer's disease. Tay-Sachs disease, Alzheimer's disease. Median population can be calculated by. True answer. Natural increase method. False answer. Arithmetic progression method, geometric progression method, life table method, demographic transition method. Population research deals with. True answer. Total population, countrywide survey, meta-analysis. False answer. Representative part of population, clinical trial. Population research deals with. The true answer. Total population, countrywide survey, meta-analysis. False answer. Representative part of population, clinical trial. Vector indices for malaria estimation are. True answer. Human blood index, inoculation rate. False answer. Parasite density index, proportional case rate, slide positive rate. Breast milk contains. True answer. Macrophages, lymphocyte, lactoferrin. False answer. IgG monocytes. Gender equity means. True answer. Equal distribution. Gender equity means. True answer. Fairness of dealing for needs by gender. Women empowerment, fairness of justice in sharing benefits between men and women. False answer. Equal distribution of resources by gender, equal rights for both men and women. Gender equity means. True answer. Fairness of dealing for needs by gender. Women empowerment, fairness of justice in sharing benefits between men and women. False answer. Equal distribution of resources by gender, equal rights for both men and women. Elements of health insurance are. True answer. Premium, co-insurance, deductible. False answer. Adverse risk selection, moral hazard. True answer premium co-insurance deductible. False answer adverse risk selection moral hazard. Modern concepts of UNICEF includes true answer child health, child education, child nutrition, child development. False answer whole child. It is a growth monitoring, oral rehydration, breastfeeding, immunization, family education, family spacing, food fortification. Approaches of epidemiological measures are true answer asking question, making comparison. False answer describing magnitude, estimating risk, evaluating outcome. Semi-variable cost includes true answer equipment cost, building cost, vehicle cost. False answer drug cost, personnel cost. Action plan on geriatric health includes true answer Vienna action plan, Madrid action plan. False answer true answer Vienna action plan, Madrid action plan. False answer Jakarta action plan, Helsinki action plan, Riga action plan. Jakarta action plan, Helsinki action plan, Riga action plan. Types of cohort study are true answer prospective study, longitudinal study. False answer nested case control study, retrospective study, crossover study. Cost efficiency concerns true answer cost benefit, cost effectiveness, cost utility. False answer cost containment, cost control. Positive science deals with true answer normative evaluation, existing situation, current affairs. False answer ethical assessment, prevailing practices. Phases of research are true answer design phase, analytical phase. False answer inductive phase, deductive phase, ethical phase. That is conceptual design and planning, empirical analytical dissemination. Community treatment is focused on community diagnosis, community resources, community participation. False answer community mobilization, community alliance. System software includes true answer operating system software, utility program. False answer library program, SPSS application, STATA. Health managers communicate to true answer organize activities, they negotiate future plan, improve predictability. False answer motivate people, conduct medical audit. Medical legal issues related to aging include true answer elder abuse, euthanasia. False answer power of attorney, autonomy, geriatric essentials.